Hello, everyone. Today we have Dr. Katie with us, and I'm so excited to have this interview because she also has her own experiences. She's a chiropractor based in Colorado, and she helps women heal naturally from all sorts of chronic illnesses. And I would love for her to share her story and also maybe go into why she took this path.
Yeah, so thanks for having me tonight. I'm really excited to be here and to chat with you and help educate anybody that's listening. My name is Dr. Katie Takacs, and I'm the Clinical Director of Women's Health at Gateway Natural Medicine and Diagnostic Center in Berthoud, Colorado. I am the only female doctor in the office, so that's my majority of my patient base are females. I got into natural medicine after having some of my own health issues. This, as most of us do, that's how we get into it. While I was in school, I was diagnosed with an autoimmune disease called ulcerative colitis, and I was going through flares of being sick and not being sick, and that's just kind of how most autoimmune conditions seem to work. And this condition had me so sick that I was losing weight. I was in and out of the hospital. I almost took time off of school. And I was bouncing from doctor to doctor with really no answers as to why I was getting worse, and just was being pumped full of medications that were seemingly making me feel worse than I already was. So I was like, what the heck? I'm going to give it a go. What do I have to lose at this point? I'm going to try seeing a functional medicine doctor. And so that's what I did. And I learned a lot about what I was eating was horrible for me. It was really hurting my gut. I had a pretty poor diet. So I haven't always had a great diet my whole life. I was eating a lot of processed foods, had a lot of alcohol, just not taking very good care of my body. And I learned how to better take care of myself, give myself nutrients that my body needed, worked on some underlying infections that I had going on in the gut, and figured out a way to keep myself healthy so that I could be drug-free for my life. So that was really what my life kind of changed in that instance. People often tell me they're really sorry that happened to me, but it's honestly one of the best things that happened to me, the worst and best. It was a horrible time of my life, but it also helped me get a better understanding of where my patients may be coming from with symptoms that they're feeling, and just like the hopelessness and fear that some of them experience. And I can truly relate to how that feels because I've been there. So that's kind of what got my passion into working in this field. And where I got into women's health was, again, after having my ulcerative colitis issues that started causing some reproductive issues. My doctors just kept telling me I needed to take a higher dose of birth control without really answering any questions as to why. And so I was like, okay, there has to be something else going on. I had a lot of friends that also were suffering from cysts, from endometriosis, from amenorrhea. And so it was something that was impacting a lot of people around me, and I became very interested in helping it. And realizing that so many women, we suffer from so many autoimmune conditions more often than men. And most of the time that is because of the connection between our reproductive system and how our immune system works. So that's kind of how I got into this area of healthcare, and I really love it and enjoy it. And it's pretty much my biggest passion in life. So I'm really excited to be here tonight.
I'm excited to have you, and today we're going to talk about gut health and hormone health and all the myths around it. You know, myself, when I had Hashimoto's, I was like in this panic attack mode because I'm like, could I have estrogen dominance? Could I have PCOS? Could I have this? You know, and I felt like my hormones, because the thyroid was off, there was a lot of other things that were off too. And most women feel that way. Like they feel like, you know, their whole body is kind of out of whack because you're treating it with thyroid medication. And, you know, that's kind of offsetting the balance in the rest of your hormones as well. So where does one even begin when they, you know, what's like a myth you've heard about, you know, balancing your hormones and getting back into check? And then where does one begin?
Yeah, so like you said, there's a lot of things that tend to overlap with these conditions, whether we're talking about gut health or the thyroid or the reproductive system. And oftentimes it's difficult to tell, you know, which came first. Was it the chicken or the egg? Did the thyroid issues cause the reproductive issues? Did the reproductive issues maybe cause the thyroid? Or is there potentially something else that triggered both of those things to occur at once? So some of the, I guess, myths I would say that I hear is I am not a fan of a one-size-fits-all treatment protocol. I don't believe that every female should be, just because you're diagnosed with PCOS, you should not be put on X, Y, and Z supplements. I think that you should have a plan that's catered to you and what's going on in your body. Some of the things that I've heard from women are the only way that I can regulate my cycle and that I can fix my PCOS is to go on birth control or to use some type of hormones. And that may be the case for some women if that's the path that they choose, and that does work for some people, but there are a number of people that that doesn't work for. And the reason is if there is something underlying, like an infection or something that's happening to the thyroid, continuing to throw hormones at someone isn't necessarily going to just fix that. There's still an issue at hand, or there's still a root cause that needs to be addressed. Same thing with kind of the gut health. When people are like, oh, in order to stay healthy, I should just take a bunch of probiotics and drink a bunch of kombucha. And again, that's something that can be helpful in some cases, but isn't necessarily always the best thing for helping to heal the gut. So I'm going to kind of bust some of these myths as we go deeper into all of this tonight and talk about things that we can do to help support gut health, why probiotics may not necessarily be the best thing for you, and what types of foods that you can introduce into your diet to help with the microbiome and your overall gut health, and then what types of things that we should focus on when you're looking at Hashimoto's as well as PCOS in terms of diagnosis and what your individual treatment plan should look like. So yeah.
I'm excited. So can you tell me like a little bit more about probiotics and why you are not for them?
So it depends. I do like probiotics in certain instances. There's some people that do really well taking them, but I've actually seen people feel worse taking some of them. And the reason is we have millions and millions of bacteria in our gut. We have more bacteria in us than we actually have cells in our body. So we're more bacteria than we are ourselves. Nerdy little comment there. So we have things that can occur in the functional medicine world that we look at called opportunistic infections, which means certain bacteria exist in my gut and your gut and anybody else's who's listening to this that pretty much just exist all the time. Things like lactobacillus is a strain that particularly dominates the female digestive tract as well as the vaginal canal. We actually have a vaginal microbiome that can be influenced from the gut microbiome, but it's a whole other topic of conversation. So if we start to have overgrowth of some of these bacteria, they can start to contribute to, they may start to create symptoms or issues in the body that you wouldn't really expect to be coming from a probiotic. So for instance, if you're taking too much of something like bacillus, for instance, this is a bacteria where if it's overgrowing, that can begin to cause issues with cramping, diarrhea, constipation, issues with digestion. And it's not necessarily that you would want to try and eliminate that because we should have some of it in our body, but we should get it into a more neutral range. So a good way that I try to explain this to people is kind of think about your bacteria all existing as like different teams. So to make this really simple, we have a blue team, a green team, a red team, and a yellow team. Now they all exist happily against each other when they all are kind of in these equal levels. But let's say, for instance, the blue team starts to get really, really strong. Well, it's going to start getting bigger and at higher and higher amounts. And some of those other good bacteria may start to come kind of down. So we don't really have this balance in our bacteria anymore. And this is where we can start to see the formation of opportunistic infections. So if you're taking probiotics that you don't need, you may actually be contributing to overgrowth of bacteria that shouldn't be there. So there is different types of diagnostic testing that we can do in the functional medicine world that look at your good bacteria, and then that can pinpoint what the best probiotic for you may be. Or one of my favorite things to do, which helps to diversify the microbiome, is eating a very nutrient-dense, wide variety diet. Different foods will influence different growth of bacteria, so that's why keeping a really a big variety in your diet is great for the microbiome.
I completely agree. I mean, I've met with other doctors and a lot of them are all for probiotics, but at the end of the day, it has to create a balance. And I've heard that like bifidum bacteria is abundant in your body. Are there bacteria that are like abundant, so no matter, you know, how much you take of it, your body uses it on a continuous basis?
I think there's some things that if you are consuming regularly, your body may use it as needed. Without, there's a lot of things that could influence that. Are you a healthy individual that doesn't really have any health complaints? Are you someone that has, IBS or IBD? Are you someone that has an autoimmune condition? So I think depending on the scenario, that can really influence it a lot. But there have been times that I've had patients come in that have been consistently on a probiotic, the same one for a really long period of time. I actually end up taking them off of the probiotic, have them add in different foods into their diet, like fermented foods. Those are some of my favorite things to have people eat because they can add a lot of fiber into your diet, and they can also they can promote the growth of good bacteria in your gut, so your body is growing what it needs versus you telling your body that to take it, basically. So other things that people can do is add in root vegetables that can help with digestion and can also help with introducing different bacteria. And then I tell people, try to eat within the season. So in the fall, you may eat a lot more squash and pumpkin-based things. And in the winter, we may eat more cranberries and pomegranates and things like that. And then in the summer, we might eat a lot more citrus fruits. So those are just some examples of eating for the season and how that can help to influence your gut microbiome as well.
Love that. And how does this kind of play in with the hormones and possibly cause an imbalance?
Yeah, so I'll start where this is a great place to start because I personally believe a lot of issues stem from the gut. Now we've probably heard a lot about leaky gut syndrome, and that's talked a lot in functional medicine. The reason why that occurs is because what may eventually start is, let's say that you have some type of infection that occurs in the gut, or there's some type of toxin that you're being exposed to that you're not aware of. Maybe it's through your makeups, maybe it's through perfumes, maybe it's just through other toxins in the environment, plastics, things like that. And those get into our body and can start to create an inflammatory type response in our body. So a good example of how to understand how this works is we've all probably rolled our ankle before. You go out, you trip, you roll your ankle, it gets really swollen and it's hard to walk on. So what's happening in that scenario is your ankle gets really big and swollen because it's trying to protect that joint. It doesn't want you to further injure that joint space. So your body will create this big swollen ankle or this big inflammatory response to help protect it, but also to help heal it. Because when we have an increase in inflammatory cells, this also stimulates the production of immune cells. The reason that happens to help heal our ankle is we want to send a lot of blood flow to the area. Blood has lots of nutrients, lots of oxygen, things that are necessary for helping to heal injuries. So over the course of a couple days, your ankle might be big and swollen, and then slowly it should start to go back down. We hope so. And the inflammation goes away, and hopefully you're kind of just past that, and that injury doesn't really last very long. So that is why inflammation is a good thing in some instances. We do want that to happen because that helps us heal and protects our body. Now, when we're talking about the gut, if there's a constant chronic stressor to the gut that's causing this constant inflammatory and immune response that never goes away, that's going to start becoming destructive to that tissue space. So think about the ankle in the same way now that we're thinking about the gut. This is going on for months and months and months, and in some people's cases, even years, we're seeing this chronic inflammation occur. So this inflammation and immune cells starts to create this environment that is inflammatory and kind of toxic, and that then creates inflammatory cells that spread throughout the body. So there's a couple of things we could talk about: the influence that this has on the thyroid, and also the influence that this may have on the reproductive system. It also can influence an area of our brain that reacts primarily to stress and can kind of activate what's called the HPA axis. So there's a lot of different things that the gut can influence, and if there's some type of infection present, it can cause this inflammatory response to occur. And again, other exposure to other toxins and stressors to the body can cause that.
So the HPA axis, what should we know about that and that sort of imbalance? The one thing I noticed was when I healed my adrenals, my thyroid actually jumped back to normal, like within range. And I still had like a few antibodies, but my thyroid numbers were optimal at that point.
Yeah, so the HPA axis is what it stands for those of you that haven't heard of this before. It's called the hypothalamic pituitary adrenal axis. So the hypothalamus and the pituitary gland are two areas of our brain, and our adrenal glands are kind of our stress organs, and they sit on top of our kidneys. So how the system works is our brain takes in stress. So this could be stress from having an infection in your body, stress from studying for finals at school, being stuck in traffic, having a death in the family, going through a breakup. Our brain doesn't really know the difference between what all of this stress is. It just knows something bad is happening to me and I have to respond to this. So our body, in response to that, will start to create the stress response. Our hypothalamus will signal our pituitary gland will signal our adrenals, and our adrenals will respond by producing cortisol and adrenaline to help us get through whatever that stressful event was. Now, this is a very, very old system in our body, and I'm going to use the classic example of coming across a bear, and you see that bear, and you either have to fight that bear or you have to run from that bear, and this is our fight or flight response. So our body produces adrenaline and cortisol to give us the energy to, in a sense, run from the bear. Some other things that are happening at that time is our liver will start to produce glucose because our body needs glucose to help with energy and to get through that stressful event. And hopefully, if we were fighting a bear, that incident is done and all of those things come back down and we go back to normal. Now, we currently live in a day where we don't just go and run from something when we get stressed out. We are sitting in our chairs or at our desk or in our cars, and we're producing all of this glucose, but not necessarily using it for anything. So this may start to contribute to issues with insulin resistance. And this can also influence the thyroid so that the thyroid isn't responding as appropriately as it should be. So for instance, the receptors to the thyroid may be slightly decreased and not as responsive to the hormones that are being produced by the brain, because in this instance, the brain is going, I have to survive this stressful event. I don't care if I can have a baby. I don't care if I can sleep. I don't care if I digest my food. I just need to survive this stressful event. So other things that we obviously are important to us may start to kind of decrease in terms of how well they're functioning. So that may have been the reason why your thyroid improved once you, improved your adrenal health, because your body probably wasn't stuck in as much of a stressful loop as it was, which then gave your body the ability to start to focus on other things like healing your thyroid. So that's probably where some of the connections there came from and why you saw that improvement.
Yeah. So what do you think of, like, these raw adrenal extract and these sort of these supplements that people take for hormone and to balance their hormones?
Yeah, so I think there's a lot of benefits that we can see from supplementation, of course. One of the first things I tell my patients is you can't out-supplement a poor diet and lifestyle. So in order, there's a lot of things that we can take for our adrenal glands in terms of supplements. And some of these are oftentimes referred to as adaptogens, if some of you have heard of those before. Essentially what these herbs do is they help us to adapt to stress. So they help kind of calm that stress response so it's not as intense when it happens and it's not happening as frequently. So those things can definitely be helpful when we're working with someone that has these issues. But I will say I have seen negative effects from people taking supplements to try and improve their hormone health as well as their adrenal health if they haven't had proper testing or a proper workup to figure out what exactly is going on. I have seen some patients that have worsened some of their symptoms because they've been self-treating instead of working with a practitioner that has kind of helped them with this. So I do think it's really important for people to work with a practitioner that knows how to help with hormones and also help support the adrenal glands and kind of looks at this whole picture. So I think that answered your question on that.
Yeah, and going into PCOS and Hashimoto's, you kind of talked about how they're interconnected and how, like, that whole surge of glucose kind of drops the ball on everything and creates this inflammation, which results in, like, PCOS. What where can like someone, you know, start their healing when they have PCOS, and what are some steps they can take?
Yeah, so there's a lot of, kind of like we said earlier, there's a lot of symptoms that tend to overlap each other. So specifically with hypothyroidism, even if we're talking independently from Hashimoto's or in someone that doesn't have Hashimoto's, we can see a lot of the same symptoms in PCOS, Hashimoto's, and even just clinical hypothyroidism. So some of that may be issues with weight or being overweight or obese. You can also have cysts form on the ovaries with hypothyroidism that is not associated with PCOS. So that's why it's also important to work with someone who can properly diagnose that, because there are certain criteria that you do have to fit in order to have a true PCOS diagnosis. So some things that you could start to do is obviously work with someone who does the proper testing. You want someone that's going to look at your hormones, that's going to look at your insulin levels, your blood sugar handling levels. It is definitely important to get an ultrasound to actually visualize those cysts that are on the ovaries. And then of course do a full thyroid workup, because if you run sex hormones, you may say, oh, these sex hormones look completely normal, but I don't have a period because of my PCOS. Well, it may actually turn out that you have Hashimoto's, and the Hashimoto's is what's causing the amenorrhea. So it's important to kind of come up with a list of different, what we call differentials, or diseases that all may be very similar to each other, and kind of slowly work through them and decide, is it this, or is it a combination of several of these things? So I'm a very objective practitioner, meaning I like to use a lot of diagnostic studies when I'm working with patients, because that I think helps me create very specific treatment plans for people. So I personally don't like putting people on treatment plans without looking at their hormones, their thyroid, sex hormones. Sometimes we'll even look at their actual cortisol production, and then looking into other things. Maybe we look at their gut, we look at heavy metals, we look at different types of infections, depending on what that particular patient is looking at.
What kind of tests do you use? Like, do you use the GI map tests, the Dutch tests? What are your preferred tests?
Yeah, so Dutch is one of my favorite companies to work with for hormones. They have a lot of really great tests, and the way that their company works is they do hormone testing via urine strips. Why that's relevant is that helps us to not only see what the hormones look like, but what the hormones are doing after the liver has metabolized and detoxified them. So our liver goes through 2 phases of detoxification, and the second phase helps make things more water soluble so that we can see them in the feces and the urine, and that's how we're able to see the metabolites of our hormones. So we can see what our body is doing with those hormones, rather than when we just draw it in the blood. This is what they look like in that moment, but we're not really seeing what the body is, how it's breaking them down. So for instance, PCOS tends to have higher levels of androgens, which include our hormones like DHEA and testosterone. So using a test like the Dutch test, we can see, okay, do you really just produce a lot of testosterone, or are you over converting that testosterone into a different type of metabolite? Our body also has a couple of different pathways that it can prefer. We have something called 5-alpha reductase, which is an enzyme pathway, one type of conversion from testosterone. We also have a 5-beta pathway. Preference to either one of those may actually make symptoms of high androgens look worse, even if they're not super elevated. So that can help us to kind of see, what is your body doing with it, and now how can we properly respond to that by either slowing that pathway down, maybe speeding another one up, and making sure that you're converting your hormones appropriately. In terms of the stool testing, or what we look for the gut, I do use a GI map. There's a lot of companies that run very similar tests, but this can look for different types of infections in the gut. This is going to look at your good bacteria, your bad bacteria. It's going to look for possible pathogens, and then we can look at your overall digestive health. Are you potentially someone that has leaky gut? Are you producing digestive enzymes appropriately? Or is your bloating coming from the fact that you are barely digesting your food and it's just creating a lot of bloating and fermentation in the gut? There's also some bacteria that are specifically associated with Hashimoto's that the literature has shown research in either triggering an autoimmune reaction to the thyroid or just contributing to the symptoms. So some of those, if you've never heard of them before, one of the most common ones is Epstein-Barr virus, and this is the virus that commonly causes mono. There's a lot of evidence that shows that having this infection can trigger autoimmune thyroiditis. And what's interesting with this particular virus is about 95% of the world are carriers for it. So you and I both probably have been exposed to it at some point in our lives. Another really common bacterial infection is something called H. pylori, where again, about 50% of the world carries it, but it doesn't necessarily always cause symptoms. So these are just a couple of different types of infections that may also contribute to some of those symptoms.
Yeah, it's interesting because we have, the world has all these different infections. They have all these different bacterias and viruses, but some people are more susceptible to getting these diseases than other people. And it's not like, EBV can ever go away. I mean, sure, we can make it go dormant, but it could always reactivate.
Right.
And, it's interesting because we'll always have viruses, but how do we stop that response, right?
Yeah.
And that's what you work on, is stopping the response, the sort of inflammation that opens the gate for the virus.
Exactly. Yes.
I see. And I'm just going to open it up real quick for Anitra. Does she have any questions right now? Let's see. Oh, hey there, Anitra.
Hi.
Hi. Do you have any questions?
Oh gosh. Everything. So I actually have been reading so much, and I read about the mono, and I actually had that back in 1999 before all of these symptoms started. So I feel like my body has gone through all of the processes. I wasn't diagnosed until 2009, but I already knew that there were some issues because after I had my son in 2001, no matter what I did, I couldn't lose weight, and I was freezing all the time, and my hair was falling out. And my mother actually had thyroid problems as well, but she passed away when I was 18. So I never, at that time in my life, I didn't know anything about thyroids or know what she had. So I feel like I was on a warpath. I was always like, go, 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 only slept a couple hours, and it was at a height all the time, just ticking, ticking, ticking. And then I noticed maybe about 5 years later, things just start to really slow down. And just like in the last couple of years, it seems like a switch turned off. Like now I have a lot of brain fog. I feel like I'm very slow. My reaction time is definitely different. So I'm trying to figure out, I don't want to go back to where I was in the beginning either. I just want that happy balance. So with my diet, I am a vegetarian. Everyone tells me I have to eat meat in order to get there. Is that true?
Well, I want to say thank you for sharing your story with me. And I'm sorry that you've been struggling with some of these symptoms for so long. And I know how frustrating it can be to not feel like you have answers. In regards to your question about the vegetarian diet, I think that that's something that it depends from a patient to patient perspective. So I have some people that do really well on vegetarian diets. I have some people that feel like absolute garbage. A lot of things that are also important to consider is the biggest thing is how much protein are you getting? So it is possible to have a vegetarian diet and get adequate amounts of protein, but you just have to make sure you're getting the right amounts. You can manage that without eating meat. So there's different types of foods and plants that you can eat that are high in protein. Pea protein is something that's really high, that's used as a supplement. It's always an option, but I don't like to use that as my favorite form of protein because I'd rather see you get it from foods. So legumes, beans are really high in proteins. There's other grains that you can use like quinoa that are high in both protein and healthy carbohydrates or whole grains. There's other things that you can look into, like chia seeds are a good source of fiber. They're a good source of essential fatty acids, so really anti-inflammatory, and they also do have some protein in them as well. For some of my patients that aren't sure they're getting enough protein, I do sometimes encourage them, if they don't want to eat meat, to maybe at least consider adding some fish into their diet on occasion if they do struggle to hit the protein that they should be getting with their plants. And this doesn't mean you have to go out and eat like a massive steak or eat a big piece of chicken or even like a massive piece of fish, but if just helping to get yourself some protein. I have some people that just eat fish a couple days a week just to get a little bit of extra protein into their system. But if you're truly trying to be primarily vegetarian, you can get enough protein. Sometimes working with a nutritionist or dietitian can help with that, because they can give you other types of foods that you can eat that are high in proteins. But it's definitely a case-by-case scenario when I'm working with my patients on what type of diet is best for them.
Okay, can you still hear me?
Yeah.
Mm-hmm.
Okay, yeah, I actually, I'm allergic to shellfish, unfortunately.
Oh, okay.
So I don't believe I'm allergic to fish, so to speak, but even still, like when my husband just made salmon the other night, I had to like leave the house for a few minutes because I felt like that inflammatory response, like I had to keep clearing my throat. I felt a little itchy and scratchy, and I didn't want to have to take anything because Benadryl
Right.
seems to, even if I just take like the smallest amount of Benadryl, I'm already like in overdrive. So everything has like this sped up response for me. Like I can't, if I go to the dentist, they can't give me anything. They just numb me and that's it. Like if they try to give me like lidocaine or anything else, I have really bad heart palpitations. My heart rate skyrockets. So it's like, I can't even take 200 milligrams of ibuprofen and I'm already like sleepy. So my whole body just seems to be like sped up and overreactive. And then I found out I'm allergic to tree nuts. So I feel like I've tried to cut so many things out and eliminate stuff, but now I'm to the point where you spoke about the gut. I'm having these reactions where it doesn't matter if I only drink water, but if I just drink a sip of water, then I have to use the restroom. I feel like I have this horrible headache. I feel really lightheaded and dizzy, like I'm going to pass out. My legs start to ache. And then it takes about 15 or 20 minutes after I use the bathroom to feel any type of relief from that. It's almost like I turn into like the Incredible Hulk for 15 minutes. And then, after I use the restroom, then I feel better. But it's almost scary to me because now it's like I don't want to be in the car for too long. I don't want to be stuck on the highway because what if I have to use the restroom? So, and I do have PCOS as well. It's just all these things have just culminated over time. And now I feel like the Hashimoto's and the PCOS are battling each other almost, so to speak, because I don't know what's causing what or how to fix either one.
So another really interesting thing is we have our thyroid hormones. So I'll kind of give a brief overview of what thyroid function looks like for those of you that aren't really familiar with it. Our thyroid, we go through, there's a big cycle. The thyroid kind of works like a checks and balance system with itself. So initially we have the hormone released from the brain called TRH, and I'm just going to keep these short so it's easier to understand me as you're listening to me. TRH is released from the brain and signals another area of the brain to release our TSH, or thyroid stimulating hormone. This then sends a signal to our thyroid to produce T4, and then T4 can get converted into its active form of T3. Now, as TSH levels get really low, then T4 will start to increase, will also start to decrease. But if T4 starts to get too low, this will send a signal to the brain saying, hey, I need more hormones, you got to give me some more, and the brain will start to produce more TSH. So in a normally functioning thyroid, this should be the check and balance system that we see. Now, that conversion of T4 into the active form of T3, most of that conversion does not actually occur in the thyroid. It occurs outside of the thyroid, with the majority of its receptor sites being in the gut. So when people start to have a lot of issues with their gut, or kind of the reactions that you're describing really sensitive to a lot of different foods, like seemingly out of nowhere, having these quick instances of needing to go to the bathroom and feeling really sick around that. If there's issues like that happening in the gut, that could be influencing the ability for the thyroid to properly convert. Now, some of the other places that we have thyroid receptors are in our brain. We actually have some on our hair cells, so that's why hair loss is considered a symptom of hypothyroidism, and sometimes even early graying, if you wanted to know, can be associated with low thyroid function. That's also what can contribute to the brain fog, depression, anxiety, the insomnia that sometimes comes with Hashimoto's and or Graves' disease. And another really interesting thing is to also consider there's a lot of women that actually have both Hashimoto's and Graves' disease that I've seen, and they will actually flip-flop back and forth between a hypothyroid state and a hyperthyroid state. So that feeling of being really, really low and really tired, fluctuating back to feeling extremely anxious and overwired almost. So those are also some things maybe to consider what's happening in the gut and how that could be influencing thyroid function. And then when we start to look at how the thyroid and PCOS can be kind of related to each other, when we have an increase in, we have a hormone called leptin that is primarily released from our fat cells. And this is kind of what helps our body know when it's hungry, when it's not hungry. And we've seen in research has shown that in thyroid disorders as well as PCOS, they tend to have issues with this hormone called leptin. So that can make it difficult to control your appetite normally, or maybe you're feeling overly hungry, or you feel like you never have an appetite. So that's something that can be influenced by that. So there's definitely a big connection between the gut and all of these different scenarios that we're talking about. So yeah, I think it's really crazy. A lot of times I'll see people that will start to heal the gut and their thyroid health will improve, probably because we're seeing improvements to the HPA axis like we had talked about earlier, but also improving the overall health of the gut so that that proper thyroid conversion can occur.
And the other thing is, I remember when I had issues, like I thought I had PCOS, so I went to go check my reverse T3 as well, which most of these doctors never check unless you're like in the ER dying. But, you know, if that was a marker, I've been told that, you know, that's usually your body's in like a chronic state of putting the brakes on, and sort of that kind of is also a marker for inflammation, to let you know that, you know, there's something going on that needs to be fixed, whether it's an infection, virus, whatever it may be, but something is causing this level to rise. Is that true?
Yeah, yes, for sure. And I look at reverse T3 as well. So kind of to go back again for people that maybe aren't familiar with this, T4 can get converted into T3 or reverse T3. T3 is the most active form of our thyroid hormones. That's what gives us a lot of our actions, it regulates our metabolism, helps with a lot of different pathways in our body. And reverse T3 attaches to the same receptor sites and can actually bind more efficiently. We're not entirely sure why our body produces it. That's something that's still being researched. We're not entirely sure what its actual purpose is yet, but we do start to see elevated levels of reverse T3, or the T4 to reverse T3 conversion may start to occur, like you said, Sweta, with infections, we may even see this with vitamin deficiencies. So something as simple as vitamin D deficiency, which is extremely common in the United States, that can actually cause that to prefer that pathway as well. Inflammation can cause that to happen. Even being extremely stressed can cause that to happen. So most of the time, especially women that have PCOS, tend to fall into a lot of those categories. They probably are deficient in certain nutrients because their gut health isn't very great, so they aren't absorbing things as well as they should be. Their body is under a lot of stress due to the inflammatory response that's occurring, and there may or may not be infections that are present that are further contributing to this as well. So yes, I do think that that's a good marker to look at, because sometimes we'll see reverse T3 really, really high and free T3 really, really low. And that doesn't mean that you need to pump your body with a ton of thyroid hormones. It just means we need to fix that conversion to going into the proper direction.
And what's like the really, really high? Are we talking like 41, 40 and above, or is it like within range? I think the normal range is between 9 to 20, right? Yeah.
Yeah, that's about what I look for my reference ranges. So anything over 20, I start to consider high, but I also kind of look at the ratio of the T3 and the reverse T3 to kind of see like, is T3 also high and reverse T3 is high? And maybe we see T4 high, and in this case, we're starting to consider hyperthyroidism. But if T3 is really low and we have reverse T3 above, let's say 20, then that may indicate that there's some sort of conversion issue. So that could be what's affecting that to occur. So one thing, if you want me to talk a little bit more about that conversion, one thing that's really interesting with this is TSH tends to be, our TSH levels tend to be higher in people with a higher BMI or body mass index. So what can happen with this is, not always, but especially if we're talking about PCOS, some of these people also have insulin resistance. So an elevated TSH and insulin resistance can decrease something called deiodinase 2 activity. And this is an enzyme that helps with that conversion of T4 into T3. So having that high TSH and high levels of insulin that's what's affecting that conversion by blocking that specific enzyme. And that can be what's kind of pushing it more in the other direction.
That's very interesting. Well, great. I think we're almost at the end of this interview here. And if there's no last comments or questions, are we good, Anitra? Did you get your questions answered here?
Can you hear me?
Yes.
Okay, yes, I think I'm good. I just, I'm going to try to keep putting all the pieces together and figure this out. I've had a really rough day today with my insulin. They did give me a glucometer to check it, and it seems, about a week to 10 days before my cycle, I have the worst issues with my blood sugar just dropping, 20 to 30 points out of nowhere. And even though it's still within normal range, I'm so symptomatic. Like, I'll literally just start shaking. I can't think. It's just been a whirlwind, but I'm trying to keep working on it, and it's not happening as often, but I would like to, be able to pinpoint when it happens, so that way I can try to avoid it as much as possible.
Great. Yeah.
I'm sorry you didn't have a very good day. I know how frustrating that can be. One thing you could do that may help you kind of pinpoint some of these patterns is to keep a diet, like a food diary. And also I tell people keep a symptom diary. So I tell a lot of my patients just to get a notebook, keep it on your nightstand or wherever it's easiest for you to remember it. And every day just jot down what you ate and then what types of symptoms you had that day. And you may start to recognize patterns in some of the symptoms that you're noticing, and that may help you pinpoint what you should look further into. Cortisol can actually play a role. Our cortisol levels fluctuating can play a role with our glucose. So that may be something worth talking to about your doctor or looking more into as well.
They actually tested that before. So should it be tested at certain times of the month, do you think, or does that not matter?
So my favorite way of cortisol testing, what is actually doing what's called a CAR test, or cortisol awakening response. So our cortisol levels will spike, and it will, in a normally functioning body, they should spike in the morning. And why it does that is it helps to kind of give us energy to get throughout our day. And then it'll slowly kind of decrease as the day goes on, and it's lowest at nighttime when we're sleeping. So our cortisol production actually fluctuates kind of separately from our circadian rhythms. So when melatonin is really high at night while we're sleeping, our cortisol is really low. And then those two things end up kind of crossing during the, throughout the day. Obviously our melatonin's lower. So when you do a salivary collection to test for cortisol, I have my patients do 6 collections throughout the day so that we can see where you're at throughout the day. And some of my patients that are having blood sugar issues, I'll have them monitor their blood glucose levels at the same time that they do that cortisol check. And then that way we can correlate the blood sugar levels with the cortisol levels at whatever time of day it was that you did the collection. So those are some ways that I do that type of testing with my patients.
Okay, yeah, that's a good idea, because I noticed that at nighttime, for the longest time, my blood sugar would go up while I was asleep. But now it seems like if I sleep more than 4 hours, it'll drop really low. It'll actually wake me up out of my sleep.
Okay.
So.
Yeah, so I would try keeping the diary and see if you notice any patterns.
Okay. Thank you.
You're welcome.
Great. Well, thank you so much. And maybe Dr. Katie, can you tell us like how we get in touch with you? What's the best way do we send you an email? Do we go to your website? What's the best way to get in touch? I know that you give like a 15-minute consultation for free prior to an appointment.
Yeah, so I don't know how far your audience reaches, but I only right now can do appointments with people within the United States. So I do offer complimentary 15-minute phone consults to all new patients. The reason I do this is because I think that if you're trying to talk about very intimate details of your life, your health, you want to feel comfortable with the person that you're talking to. So if getting on the phone, you talk to me and go, nope, that's not a fit for me, then at least you know before you commit to care. It also helps me to know that maybe I'm hearing a lot of symptoms from you and I think that I may not be the best fit for you, or I may be able to refer you to someone else. And so that kind of gives us an idea of where we may start in care with each other. So the best way to reach me is to contact me at my office. Our phone number at our office at Gateway Natural Medicine is 970-532-2755. Or you can email our office at info@gatewaynaturalmedicine.com. And just be sure to mention that you're looking to set up an appointment with Dr. Katie, and the girls that I work with are wonderful. They'll help you get set up with that. You can also follow me on Instagram. I post a lot of info on educational, just tidbits of information that I hear from patients asking me questions, or just things I think people will find interesting. And also some tips of things that people can do to help better their health. So those are some ways that you can find me.
Awesome. And one last thing, what's your biggest takeaway today?
I think that the biggest thing is to find help if you need it. There are a lot of people out there that do hormone work, and I can't speak on the education of a lot of people, but I do think it's really important to work with someone who is qualified and does have extensive background in the human body as well as hormones. Like I said, I can't really speak for others, but I've had multiple years of school. I teach to other practitioners around the country, and I've been in clinical practice for several years now. So a lot of this is based on my experience. And then also try not to self-diagnose and self-treat. I did that myself when I was really sick years ago and I wasn't getting better. And even now as a functional medicine practitioner, I still have doctors that I go see because we can never be objective when it comes to our own health. So I really encourage you to find somebody that can help you, that can answer your questions, and that helps you feel safe and accepted in what you're asking for.
Amazing. Thank you so much for being on the show today, and maybe we'll have you back in the future.
Yeah, thanks for having me. It was really fun, and I always enjoy nerding out talking about my favorite topics. So thanks for letting me do that.
Very informative. All right. Well,